Hi, it's Dr. Carla from the Cognitive Clinic, and I wanted to just talk a little bit about stress and anxiety. So, typically, when we're talking about stress, it's usually a response to something that's external, whereas anxiety is generally a reaction to something that's internal, right? The way we're thinking or perceiving something, right? Stress will usually go away, once that situation is taken care of, where anxiety is a little bit more persistent, right? There's a lot of apprehension, there's dread. What if this doesn't go right? Oh my gosh, what if this? What if that, right? Stress can be positive or negative, right? So, like, it might push you along to meet a deadline, right? But it could also cause you to lose sleep. Where anxiety, it doesn't tend to be very useful, and it tends to be much more constant, even if there's not anything going on, right? And so the hard part is that both stress and anxiety are going to show up similarly in regards to symptoms. So excessive worry, uneasiness, tension, maybe you get a headache or your body hurts. Blood pressure might be going up, more than usual, loss of sleep, right? So you might be like, oh, is this stress? Is this anxiety? Right? So then I would say take a look at where that source is coming from. If it's all external and there's nothing internal, it's stress. I'd say maybe you want to figure out a way to reduce that. It sure wouldn't hurt you. And then on the flip side, if you see a lot of internal stuff and it's not a lot of external stuff, right, then it's most likely anxiety. And so whether it's stress or anxiety, you probably should do something about it, especially if you're having all of these symptoms that are making it difficult to make it through life. And again, navigating this is really hard. And I know a lot of people don't want to admit that they need help. But help is really the best way to go. Reach out to a mental health professional. That's what they're there for. They're going to help you figure it out, right? You don't win a prize for being the most stressed out person. Right? The most stressed out person does not have everything, because that chaos will eventually just kind of eat away at their well-being. Reach out, get some help. It is okay.